You know what, I'm gonna go ahead and do introduction. But Mary, and I'm delighted to say I actually met Mary in person at a retirement party August 31st. And I'm here to say that it truly is more wonderful to meet people in person. So I was really delighted to see you just for a few minutes. But Mary is our Associate Dean for Clinical Affairs at UIC College of Applied Health Sciences, which is the college that in the Department of Human Development. Mary is also Director of Interprofessional Education, which is housed within UIC Office of Vice Chancellor for Health Affairs, and is the co of the Interprofessional Collaborative Practice HIV prevention. And Mary did let me know that she's been at the center. I shouldn't say it like that. She's been doing, she's been working in IPE at UIC since 2007. Mary has like a wealth of knowledge and is also part of the National Center on Interprofessional Education as a member. So she has a lot of background experience working with Barbara Brandt up at with the Nexus. And the other thing that really terrific with Dr. Keehn is that she has served as a faculty member in UIC Department of Physical Therapy, along with Director of Rehab Services at our hospital at UIC, the University of Illinois Medical Center. So she brings to the IPE both as a practitioner, a faculty member, and then a long time. And I think you actually started the IPE work at UIC. On that note, I'll ask Mary to respond, and then I will be quiet. In fact, I'll even mute myself.
All right. Thanks, Beth. I will. Yeah, actually, you're never doing IPE by yourself. So everything that has been accomplished by a group of people, and so. But I have, did end up with taking the lead officially in 2015 when a campus level position was established. But we started as a faculty group in 2007. So I'm going to share my screen, and hopefully, I'm always hoping that these will be more dialogue than presentation. So feel free to. It does help me, however, if someone else watches the chat, because I'm really not good at monitoring the chat and watching slides.
And I can watch the chat. Do you want me to collect questions, or what's a good way to handle that for you?
To be honest with you, I would trust you to use your judgment if there's something that needs to be
gotcha.
Said right away. That's good with me. So I'll go ahead and get started. So when Beth had asked if I would present, I was thinking about trying to, I'm always trying to get something out of putting something like this together. And so what I was hoping I'd get out of doing this presentation for today would be some of your thoughts on this idea of how we address the need to give some group of learners, foundational plus knowledge, I'll call it, in relationship to a specific population. And since this project is really about people with intellectual and developmental disabilities, it's a good example of a topic where I often try to balance what does every student need to know versus what is the knowledge that a group of people need to know because they're going to be, fully engaged in working with a population like this. So that's kind of my thinking behind what I'm going to present, to say, here's what we're doing across the board, and then what do we want to do specifically in relationship to IID. So as Beth mentioned, I have a couple of roles at UIC. I've been at UIC for more than 40 years. And so I was the director of the rehab services and a faculty member in the physical therapy department for a long time. And now I have a role in the vice chancellor's office to develop the interprofessional practice and education, and in the College of Applied Health Sciences to develop the faculty practice. So all of those things end up intersecting quite a bit. So today what I'm going to try and go over is a little bit of an orientation to the University of Illinois system and how we go from a big system down to CAPER, which is our Center for the Advancement of Interprofessional Practice, Education and Research. Think about broadly about our learners, and then think about this idea of what foundational knowledge is needed by everyone to engage in interprofessional collaborative practice, and then what are the specific knowledge, skills, and attitudes that we would want people to have when they're working with specific populations or in specific settings. First, because I think it is always, it's not always clear to everyone, the University of Illinois system, when people say U of I, people sort of focus on different levels of the system, but in this current 2022, what we have is a University of Illinois system with made up of 3 universities: the University of Illinois Chicago, the University of Illinois Springfield, and the University of Illinois Urbana-Champaign. And I say that because up until maybe the last decade, well, there's a College of Medicine now in Urbana, and there has been a College of Applied Health Sciences in Urbana for quite a while. But really, the University of Illinois Chicago was the health sciences training site for the university system. And so while we still do have the vast majority of health professions programs within the system in Chicago, there are several programs at Urbana. But the total enrollment for the system is about 95,000 students. And about 32% of those are underrepresented minorities. So it is a big piece of U of I's identity to be trying to advance opportunities in education for people who have not always had access. And again, another flavor to the system is that it's manages a research portfolio of over $1.1 billion. So again, those are all things that kind of influence our culture and our decisions. The University of Illinois Chicago is also a minority serving public urban research university, and it has 17 colleges, and 7 of those are designated as health science colleges. Again, I'm not sure how many people are from the Chicago area, but our campus is really geographically across a couple mile area with some residential areas right in between what used to be called the east and west side of campus. Our east side campus is the more traditional university campus, and originally was and is still to some people known as Circle Campus. And then the health sciences were always on the west side, but it's been since 1980 that we have been one campus. But that doesn't stop people from still talking about Circle Campus or the West Campus, those kinds of things. That overall we have about 34,000 students in undergraduate, graduate, and professional programs. And an important thing is that we have, although the majority of the students are on the Chicago campus, we have 5 additional regional campuses around the northern half of the state. And those are health science only campuses. And those are in Peoria, Rockford, Urbana, Champaign, Springfield, and the Quad Cities. So again, when you're thinking about the development of IPE, it's although we consider ourselves an urban university, we have certainly a lot of more rural counterparts that we attend to. We serve many rural populations. And then we also need to take advantage, we're currently taking great advantage of our ability to do things virtually to engage students from all those campuses in the same learning experiences. So I just wanted to point out quickly that the University of Illinois Chicago mission does include specifically training health professionals and serving underserved communities, but it's only one of several components of the overall mission. And I particularly like this commitment to the great cities, because I think that does really help, which is the third bullet. It really helps us focus on how do we help cities solve their problems. And I think that healthcare is of course only one of those, but it's an important piece of our mission. So I'm drilling down to UI health, and this is another term that often needs some clarification. So there's that UI health includes this. We have 7 health science colleges: applied health sciences, dentistry, medicine, nursing, pharmacy, public health and social work. And we have a healthcare delivery system that includes the 465-bed University of Illinois Hospital and over 500,000 outpatient visits a year that are provided at our on campus at in the outpatient care center and a newly opened specialty care building. At Miles Square, which is a network of 14 federally qualified health centers, at 21 other off-campus clinics, including one that opened recently at 55th and Pulaski, which is a collaborative with other community agencies. And one of the characteristics of UI Health is that we serve a large Medicaid and uninsured population. We have about 5,500 students total enrolled in our health science colleges, and again, 90% of them are enrolled in health professions education programs. So learning at the baccalaureate, graduate, and professional levels, preparing to be involved in the healthcare delivery system in some way. And these are, we have, you'll see in a minute that there are both clinical and non-clinical programs. And here are those numbers. And again, important to note here is that we're talking about students in a lot of different professions, but also in programs that are offered at very different levels. So we have some students that their program is part of a baccalaureate program, which means it's basically the last 2 years of an undergraduate degree. Several that are classified as graduate programs, again, typically about 2 years in length, but and so they're on but after having earned a bachelor's degree in something else at least. And then we have mostly professional programs, which are typically 3 or 4 years each, although our DNP program actually has an option to go anywhere from 3 to 5 years. So again, the point here is that we have a very diverse group of learners, and you can see the distribution geographically around the state. So that I think that's so that gives us a little over 5,000 people involved in our educational programs. And the way we engage them all, obviously, they all take what we'll talk about in a few minutes, which is the Foundations of Interprofessional Collaborative Practice program. But beyond that, their experiences are not just different, but more complete for some students and less complete for others. And that's one of the things that we're trying to address through the development of the center. I'm going to keep going for a minute, and then we'll stop to see if there's anything anyone wants to ask about. So we are very excited to say that we did get approval from the Illinois Board of Higher Education just in May to establish CAPER, which is the Center for the Advancement of Interprofessional Practice, Education, and Research, and that's housed within the Vice Chancellor for Health Affairs Office. The current staff consists of myself and 2 project coordinators, and that is the staff for the center at this point. And we otherwise rely on the contributions of many other faculty, students, and staff in order to move things forward. And the core functions for CAPER will include development of the curriculum, the pre-qualification curriculum. So that's everyone who is, will enter a healthcare profession. Whether or not it's a licensed profession is a different discussion. We'll be developing interprofessional clinical practice and interprofessional clinical training. We will be developing student engagement and leadership opportunities, faculty development, and those will all be faculty. There'll be faculty leads appointed for those 4. And then the last 2, which are program evaluation, scholarship, and the infrastructure, will be managed by the center staff themselves. And then just to mention that the CAPER mission is really about changing healthcare professions, education, and service delivery to really think about how collaborative competence and interprofessional teamwork can improve outcomes across education, service delivery, and really eventually we hope to be able to have positive impacts on communities. And our real focus is on underserved individuals and populations. So I'm going to talk a little bit about our groups of learners. We really focus on 4 different groups of learners, and obviously the first is the students in our health professions education programs, and our the faculty at UI Health who contribute to our learning experiences. We have a health system that needs that has a couple thousand employees that are all needing some level of development in the terms of interprofessional collaboration. And then because of our role in the state, we also believe that we have that there's a need to help health professionals at large gain knowledge and skills related to interprofessional collaborative practice. So the learners don't just, it's not just our students, it also includes these other groups. Beth mentioned that we started this in 2007, and that really was a grassroots group of faculty that were involved in that, some of whom are still involved in addition to myself. But it was one of those things that started out as we launched these, it was actually 2-day workshops that we offered to students over the holiday break. They came in during their holiday break to participate in this 2-day program because they were also anxious to be involved in interprofessional education. And we started with that with 22 students. We did it again with 30 students. And at that point, the provost, we went to the provost and we said, we'd like to expand this. And he said, well, if you're going to expand it, you're going to have to expand it to include everybody. And so we went from doing something that was kind of, you can picture, small, fun workshop to something that was a very big lift to deliver to what turned out to be a little over 800 students that first time that we did it. Things continue to evolve. And so I mentioned in 2015, there was a position established at the campus level. We created a strategic plan, and when the campus reorganized, we moved to the Office of the Vice Chancellor for Health Affairs, and the position of director was established. And we have continued to have annual campus-wide IPE immersion events. And at that time, they were still in person in Chicago, Peoria, and Rockford. And then in 2018, because the accreditation standards for all the programs kept evolving. In fact, it was our pharmacy faculty associate dean, Marika Schoen, who said to us that pharmacy really needed something that was much more formalized than what we were doing. And so we went through a major effort to revamp this program that was very much that everyone got a lot out of, but had been developed in a way that the learners were at very different places in their education. So we had some students that were at the very beginning of their education, some that were close to graduating, and and we needed to fix that in order to really plan this foundations course, which we started planning in 2018. We initiated it and piloted it once in person, and then I probably don't even need to say that in 2020, we ended up having to transition it to a virtual program. And so now we have the Foundations of Interprofessional Collaborative Practice, which is embedded in all 13 different health professions education programs. It's offered virtually to students around the states. And we will probably continue in that mode because it's our best way of reaching the students in all of the campus and providing enough diversity within each of the interprofessional teams so that there can be good discussion. I do want to mention one other thing here is that our Foundations of Interprofessional Collaborative Practice program is not a standalone course. Although it's designed to be 1 credit hour, it is embedded in all of the different curricula. So that's an important thing that we are looking at in terms of our future growth is what to do about programs that are going to be offered through the center, but will be taken by students in many different colleges. And at UIC, that's sort of a logistical hurdle that we will need to address. This is a little bit of a description of our Foundations of Interprofessional Collaborative Practice course, and we do have over 1,300 students and 13 programs. This course is managed by a curriculum work group with instructional designers from the UIC Learning Technology Solutions Group. It consists of 3 online modules followed by a synchronous immersion session. So the modules are designed to take a minimum of 6 hours, and the synchronous session is 3 hours. And then students do worksheets. They do work related to these modules that ends up generally increasing the amount of time that they have to spend beyond that. We really focus in terms of interprofessional collaborative practice on the IPEC competencies, which I know have been discussed in this group previously, and on concepts related to team science. And I probably should add that in the last couple of we are currently thinking much more about how we incorporate the social determinants of health and health equity into the foundations course, because it is, again, a very basic part of understanding why we need interprofessional care. The clinical content has evolved over time in this program. We started, our first clinical focus was on a woman who fell at home and fractured her hip. The last few years, our content has been on in the area of chronic pain and opioid use. And we are transitioning to the clinical content to sickle cell disease over the next few years. Because, again, if you think about the variety of students that we have involved, sickle cell disease is a lifelong condition that affects every aspect of health and social behaviors. And so we really feel like it will be a place where policy and healthcare financing and all has a big impact. And so we feel like it'll be a very robust topic to be using for this foundations course. People often ask me whether or not we have other learning experiences in addition to the foundations course, and we certainly do. And I think that that's another reason why we thought it was important to establish a center was in order to put some structure around all of the things that were being offered. Right now we have learning experiences that are built into courses across programs, generally initiated by faculty for students in 2 or 3 programs. And while this is a great opportunity to give students experiences that might spark a lifelong interest in some particular topic, we are not reaching all of the students with a consistent level of education or with consistent objectives. So that's one of that's something that we're hoping to be working through over the next couple of years. We have started providing some support for the development of IPE innovation, and we have funded our first 2 projects, which are, one of them is, I think you may have heard about already, but it's Sue Kilroy and a team. I think I saw Mike Gornkowski on this on the call today, and Blaze Brown from dentistry. And this is to give students the experience of working with people with complex needs, and actually having people with disabilities serve as part of the educational staff. So being trained as standardized patients to work in our simulation center. And from what I hear, it's going quite well, but we don't have the final results yet. And then the other one is actually a first death experience. It's an interprofessional experience for students in right now medicine, pharmacy, and nursing. And it's to think about the impact on healthcare professionals of a patient dying in the midst of your work shift, and how those things you need to think about that and process that, and how being a member of a team can actually be one of the positive ways of trying to cope with that successfully. And so that project is close to wrapping up, and is and I know looking for ways to be sustainable. And now we have our second round of the seed funding is open for application right now. And then we have several externally funded programs, mostly HRSA. Macy Foundation has been another funding source, and they're listed here. That the interprofessional approaches to health disparities is a program where student teams go out into community settings in areas such as domestic violence, HIV, aging, refugee health, those kinds of places, and work on projects with the community partner. We have had a funded program for HIV prevention and care for about 9 years now. We also have, the project Engage Illinois offers a summer program called the Scholars and Leaders in Interprofessional Geriatrics. And then we also on campus for a long time have had a LEND program, Leadership Education in Neurodevelopmental and Related Disabilities. So again, lots of things going on, but from a centralized perspective, we have a lot of work to do to figure out for each of our students. If you think about the IPEC competencies, we have students enrolled from 2 years, 3 years, 4 years most, and then a few here for 5 years. And we haven't really identified the endpoint competencies in interprofessional collaborative practice that we should be working towards for each of those students, because it doesn't make sense for a student that goes through a 2-year baccalaureate program as part of a baccalaureate degree to achieve the same level of competence as someone who might be going through a 4-year post-baccalaureate degree or a doctoral level program. And we need to be more thoughtful about figuring out what experiences each of those different groups of students need to have in order to then enter the workforce and be able to successfully collaborate and actually hopefully advocate for collaboration and lead in some cases. So let me stop for a moment.